we move forward into the book a little further. Motor testing. We all are taught to test, say for a cervical radiculopathy, we're looking for some kind of a deficit there in terms of strength. Eric, talk to us a bit about maybe how you teach your students muscle testing and what the evidence suggests, in terms of its utility.
Manual muscle testing specifically?
Yes.
Yeah, I think it's a great debate. I think the problem is that it's not super reliable. And so it varies greatly from clinician to clinician, but it has pretty good reliability. My understanding is within the same clinician, it's fairly reliable. So from a musculoskeletal standpoint, and Chad can correct me if I'm wrong, but I think it's valuable as either it reproduces the concordance sign or it doesn't. It's also probably value in that as you're comparing that one side is weaker than the other. I'm not sure there's much value beyond that. So grading it in a 1 through 5 scale or a plus or minus scale, it really probably is not a very good idea. I do get an argument, though, that I totally understand from, for example, physical therapists who work with patients with spinal cord injury, where they are looking for just a trace of a muscle twitch that they can really work with and develop. And so I get, in those cases, maybe using a more graded system, but that more finely graded system, I think, is to continue to justify the need for physical therapy, that people can benefit from it. So I think in that case, it serves a different purpose. But as a test with diagnostic accuracy, doesn't mean I don't use manual muscle testing. It's certainly part of my exam, but I am largely trying to see if it's weak one side versus the other and reproducing of the concordant sign.
Mm-hmm. Chad, do you have anything to add to build on that?
Yeah, I totally agree with Eric on that. And again, subsequently, there have been a number of studies that have come out and have looked at strength testing or strength loss in relationship to lumbar radiculopathy or cervical radiculopathy. And what's interesting is, like Eric mentioned before, they're coming up with likelihood ratios around 1, which suggests that it doesn't really distinguish if a person has radiculopathy. And there's probably 2 reasons for that. One is that a lot of individuals will have lumbar or cervical radiculopathy, but it's subclinical threshold. It's not exhibiting any signs in that particular patient. So we miss it because when we do our tendon tests or, a reflex tests, we do our sensibility tests and our muscle tests, they're subthreshold. They don't actually identify it. There's a really nice paper that is going to be coming out in JOSPT that suggests an alternative neurological examination. I mean, we all, when we went to school, we learned tendon testing, sensibility testing, and manual muscle testing for neurological screen. In this particular paper, they talk about some of the limitations of strength testing. One of those limitations that most people can hold a break for 1 count, but it's the repetitive break the repetitive strength test that they lose strength on. And the other is that basically there are other things out there that might be more beneficial in identifying radiculopathies.
Interesting. So that paper that's coming out, it's looking at repetitive, say, shoulder flexion, and to see, does the power start to wane over a period of repetitions compared to the alternative or the contralateral?
No, it suggests that strength testing should be repetitive versus a single break. Because what you'll see then is a person, they may be able to hold that first repetition, but you'll see a marked decline on the side that's affected. And because most clinicians don't use a lot of force in their manual muscle tests, that ends up being subthreshold and an ineffective test. Now, if you get Eric, who's 6'6" and well over 200 pounds, doing your strength test, he's going to find some weakness. But a lot of clinicians don't actually identify it.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.